So what I learned at the Czech Institute was a term called working in. And Paul helped us to understand that there's a big difference between working in versus working out. So let me elaborate on that a little bit because it'll be vitally important. So before we earn our rite of passage to the box below here I'm lifting all this weight. Notice there's no weight belt on. Remember, I had a bulging disc. I had an inguinal hernia. I had the digestive issues. And I came back 25 years later and they said I would never do this. But I started up here in this box. I had to rebuild, reset my system from the inside out. I had to address these lifestyle issues again, make more changes, and reset my system using the principles of working in and mindful movement exercises, and then using it on me and then my patients. And later when I opened my own facility, I did the same thing with my clientele. Why? Because the difference is at the beginning of restoration, it's all about resetting, reprogramming, right? A system that's over-innervated. We need to calm it down so that we can properly restore the programs. But if you keep plugging things into a light socket that can't take the demand, you're going to just keep tripping your breaker box. And that kind of overstimulation can be related to, like when I talk about movement as medicine, that's a wrongly prescribed amount of intensity for that level, the level at which the patient is at. So much like the wrong prescription of a drug, you can have a side effect. When exercise is wrongly prescribed, there are side effects associated with those as well. Several years ago, I wrote a couple of articles called The Yin and Yang of Exercise, a part 1 and part 2. Now I'm going to refer to some of the information in part 1 to help you understand more about the importance and what it means to work in and to use a mindful approach to exercise. So let's start by first understanding the principles of the yin and yang symbol. Now the first thing is we usually see the yin and yang symbol depicted in black and white. And what I did when I rebranded my business back in 2016, when I hired my graphic designer to come up with a new logo and colors, he picked green because it represents growth, and he picked orange because it represented action. So the green represents the yin, and the orange represents the yang. So, and in the yin, there's a little bit of yang, and in the yang, there should be a little bit of yin because we have a little bit of both in us. It's just when the pendulum swings too far, so hence when somebody's in pain, they have too much yang, so they need more yin. But we don't want to take all the yin out, nor do we want to take all the yang out. So yin is the negative, passive, or feminine principle. Now, I'm not saying negative from a disempowering standpoint. That's to take away. We need to take the pressure off the system. It symbolizes inward anabolic energy. That's to build up. So now I'm going to refer back to the circadian rhythm when it comes to yin and yang. So this is too much yang, and here's a balance of yin and yang in your circadian rhythm. It represents night, cooling, unity, nature, create, mindfulness, desire, building or joining together. So think of a woman that's having a child. That child is growing in her womb. It's going through the yin process. Essential activities for repair, regeneration, and quietness. Where yang is the positive. So that's the charge. The positive charge versus the negative charge, or masculine principle in nature. It symbolizes outward catabolic energy and represents breaking down or division heat provoking an inflammation. So going back to the bottom box here, that's working out, to exercise, to express, to perspire. I'm getting that out of me. It also represents inflammation. Fire, heat, as opposed to yin, which is more water and cooling. And then you have the empowerment of willpower, transformation, and the expending of energy. So yin is associated to the parasympathetic system, where yang is associated with the sympathetic nervous system. And we need a balance of both. And exercises at the beginning of any kind of restoration program need to be more yin than they do yang. Remember how I was saying that at the beginning we want to have the exercises in an unloaded posture? Because when you get loaded, when you get vertical, there's more neurological stimulation, so that becomes a more yang, a more workout. Balancing on one leg takes more effort, where lying on your back doing an exercise takes less effort. So, so we have to be very careful on how we prescribe exercises.